Welcome to this week's OK at Work with myself, Sarah Sawyer, and my colleague Russell Berger from the Labor and Employment Group at Offit Kurman. So this week we are talking about the end of the state of emergency in Maryland. So at this point, Governor Hogan has announced that the COVID-19 state of emergency will conclude on July 1st. And for me here in Baltimore City, Mayor Scott also announced that it will end here in the city as well, that mask mandates are going away, which we've been hanging on to here in the city. So some exciting news, really low positivity rate. So we've been getting a lot of calls, obviously, from clients about what now, and what still needs to stay in place. And generally, even though this is really exciting news and things, it's not completely over, in the sense that employers definitely still need to have rules in place regarding someone sick coming to the workplace and things like that. So what are some of the things that still need to be in place, Russell?
Yeah, well, first off, I mean, this is fantastic news. We've made a ton of progress, and just like you see those numbers about cases and positivity rates, and they're all coming down so low, and the vaccination process has been tremendously successful in that respect. So that's just we should take a moment just like acknowledge like this is awesome. Like we're 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 somewhere in the end phase of this. Um, and that's great news for all the employers out there too.
Yeah.
So with that said, there are still unvaccinated people. COVID still is out there. So we still have to have policies in place that address that. So for example, if unvaccinated people are having close contacts, they still shouldn't be coming into the office because they could spread it to any other unvaccinated people in the workplace. If you're fully vaccinated, then the rules are very different. We don't have to worry about that as much. If you still have people working remotely, you haven't brought people back yet, you still need to have remote work policies. You still need to be on top of that aspect of it. And then, there's CDC guidance out there. There's new OSHA guidance regarding safety in the workplace, and it's mandated for certain healthcare facilities. It's not mandated for employers more generally. But there is good guidance in there in terms of how to keep your workplace safe, and certainly that's a good starting point for the conversation. But it's also you know time to be a little more practical about it, and a lot of the distinctions are between vaccinated workers and unvaccinated workers. And from what I've heard from a lot of employers, they're not really interested in trying to determine who's vaccinated, who's unvaccinated, and then policing the unvaccinated group and holding them accountable and punishing them when they don't follow the proper protocols. I mean, when there's close contact, you're still asking people to disclose that. But in terms of mask wearing in the workplace and social distancing, those are things that I think are changing and becoming a little more lax, even though there's still unvaccinated people that might be coming into the workplace. So in that respect, I think what a lot of employers are doing are saying, we're not necessarily going to mandate this, or maybe we will, maybe it will be our policy, but you're kind of on an honor system, which is about as good as not mandating it, and saying follow the guidelines. Follow these policies. We strongly encourage you to follow these policies, and just kind of leaving it at that.
Yeah, I mean, that's what I've seen in most instances, is a clear policy around, well, here's what people who are unvaccinated need to do as far as close contact and as far as wearing a mask, and then what fully vaccinated people need to do. There's also another layer to it that was also covered in the OSHA guidance around at-risk employees, which is generally employees who either can't get vaccinated because they have an underlying health condition that prevents it, which is, I think, a very small amount of people, or that when they get fully vaccinated, they still aren't going to have the full immune response to the vaccination due to an underlying condition, immune disorder or transplant or things like that. So that's also just kind of another section of your employee population potentially that also needs to exercise care because they're at risk. So also putting that into your policies, or putting that information out there, and being prepared for potentially people to make ADA requests. If they are an at-risk worker and maybe they need some accommodations. So maybe if you're taking down physical barriers around the break room or the office, that you might end up leaving some up for, workers that are either unvaccinated or in that at-risk category, or might feel more comfortable still wearing a mask and being separate from other employees, or just being prepared for people to ask for those types of accommodations. And even if they don't have an underlying disability that would make them qualify for an ADA accommodation, where it's feasible to do so, probably a best practice to try to make people as comfortable as possible if they still want to have some of these barriers and it's not going to interfere with their job. So just some things to consider, I think, especially in physical workplaces where people don't have their own office, or they still want to be distanced a little bit and kind of see what the practical approach is. I think that's a great point, Russell, that you made about just, now we're really getting into the practical. The laws are, kind of being stripped away as far as the strictness and the mandatory requirements, but really what is the practical implications now and what makes the most sense in your workplace?
Yeah, it's definitely a conversation all employers should be having.
Yeah. Well, thanks, Russell, and we will see you next time.
Thanks, Sarah.